Breastfeeding is incredible for the healthy growth and development of babies. And now, one Nigerian company is working to make sure that women who have trouble lactating can get the help they need.
I started Milky Express in 2015 after the birth of my daughter in 2014. I had a very difficult pregnancy and I was looking forward to having the baby and having everything go easy. But after she was born in 2014, I had a very rough time breastfeeding. Fortunately for me, I was able to meet with a lactation consultant in the US because I had her in the US, and it was at that point I realized that that profession actually does exist. So after working with them for a while, I came back to Nigeria and I still needed the support. And you know, I was also using lactation products that I used to buy in the US, but I realized that it wasn't sustainable for me to keep buying it and importing it into Nigeria. So I decided that, okay, since nobody was making this thing, let me just go ahead and try out the recipe for myself. So I tried it out and it worked, and I started using it and I started to share this recipe with family and friends. And a lot more people wanted it, and I realized that it was costing me too much to make the product and give it out for free. So I started to put a little fee on it, and as time went on, more and more people wanted it and were very willing to pay for it. And that's how the business started.
Medunoye decided to become a lactation consultant to better handle more complex cases for women.
The more I worked with mothers, I realized that a lot of mothers had peculiar issues that I could not help because I wasn't a professional. You know, so I started to make inquiries to see how I can be certified and how I can get the knowledge that I need to be able to help the mothers. And this took a while. You know, it took a long time of study, and it took a long time also of clinical internship or clinical hours working with another lactation consultant in the US. And you know, that's how we've gotten to where we are today.
She says she faced a few challenges starting this business.
People did not know what lactation products were. It was the first of its kind in Nigeria. People were like, what is, like, how does this help me? Is it made from breast milk? What is this? Getting people to be able to be honest about their breastfeeding difficulties and their breastfeeding challenges was also hard because, first of all, a mother is going through this difficult stage. You're having a conversation with a mother and she breaks down and she's crying and she says that when she tells people that she has breastfeeding difficulties, they say that she's not a good mother or she's not a real mother, you know. So people were not as willing to open up and talk about their problems, and you know, people were not as willing to try the products. But now, I mean, over the years we've been able to create good brand awareness, and people know who and what Milky Express is, and are able to trust the brand for their breastfeeding solutions.
Today, Medunoye is Nigeria's first international board certified lactation consultant.
A lactation consultant is actually the only healthcare worker that is professionally trained and given the clinical expertise to actually help with breastfeeding and human lactation, and this is actually really needed for breastfeeding. The WHO also recognizes the lactation consultant's role in all things that encompasses breastfeeding, whether policy making, educating, you know, trainings, everything that has to do with breastfeeding.
Today, women are more open about discussing their breastfeeding challenges, and Milky Express provides professional counsel.
I worked with mothers who have had trauma with regards to breastfeeding, who are very frightened of breastfeeding, but they don't have anyone to talk to. And when they talk to people about it, people are mostly judgmental because they don't want to breastfeed. So right now, the market is more open, people are more accepting, and you know, haven't had time to talk to doctors to educate them on the role of a lactation consultant. Doctors are also more willing to work with us to help so that we can, you know, all together, we can together help the mother and the baby.
She also teaches rural women about breastfeeding through her foundation.
What the foundation does really is to go into rural and suburban communities to educate them about breastfeeding, and not just educate them but bring them up to speed on best practices when it comes to breastfeeding. So we dispel a lot of the myths, and trust me, we've heard them all, from people saying that if you travel, you can no longer breastfeed because your breast milk will go sour, or just a lot of things. And people saying that how can you give a baby food and not give the baby water? So if you're breastfeeding, you have to give the baby water. A lot of those issues, we're able to re-sensitize and re-educate the public about what breastfeeding is and what breastfeeding should be.
Breastfeeding is best for babies. And for mothers having challenges lactating, companies like Milky Express are providing helpful options to make their breastfeeding experience easier and more productive, so they can focus on bonding with their babies. For Nigeria Health Watch, I am Dara Ajala Damisa.